Welcome, welcome. Today, we are going to be talking about the problem with health claims in yoga. So we're kind of going to be digging into a discussion about like the biomedical miracle claims in yoga and how we might approach these with ethics and safety in mind. And as you may have noticed in your studies, yoga is unfortunately saturated with claims of both the healing power of yoga in general, as well as technique specific miracle health benefits. This pose, this breathwork technique, this meditation will heal such and such. And this certainly has been amplified by social media and the internet, and more recently by AI. When we're talking about our practice, like modern postural yoga, these claims, this misinformation has been a constant throughout the evolution of our practice. So it's kind of nothing new. And unfortunately, most of these claims have no evidence base or even a reasonable mechanism and are not necessarily even part of the ancient or traditional teachings of yoga. And really importantly, they can be harmful to our students when we pass them along. So this week, we're going to talk about this tricky subject. If not today, at some point, we'll have a discussion where we talk about the many evidence-based benefits of yoga. One more thing before I start. I keep saying this is a tricky discussion, and it's because we all come to yoga with different beliefs, and then we might adopt new beliefs or explore new beliefs along the way through our studies. So I just want to flag that we might disagree on some of the topics discussed today, and that's okay. Let's just open a dialogue, and I hope that I can give you some ideas to get curious about and to think critically about, and I hope that if nothing else, it helps to improve your yoga studies and your teaching just by having had the conversation. So first, what prompted this discussion? Over the past couple of weeks, I've had a few exchanges with folks who are working on their asana studies or their breathwork studies assignments and looking at contraindications or benefits of yoga, and mostly finding it really confusing when they're looking for that information. And I agree, it's really confusing out there because, I mean, obviously we want to keep ourselves and our students safe in practice. It is really hard to navigate all the information out on the internet and books and podcasts and videos about the risks and benefits of yoga. Because how do we know what's evidence-based, right? What is traditional teaching and what's made up yoga propaganda? And how are we as yoga students to know, right? And also I want to acknowledge that there's a lot science still can't tell us and perhaps never can. I mean, who's funding yoga research to start with? There's not a lot of money in that research. And like, who's out there developing an MRI so we can see our chakras and nadis, right? So in the meantime, we have to rely on either genuine teachings. If there isn't an evidence base for something, we have to rely on the traditional teachings, our own personal or shared experiences, and then providing judicious and respectful information to our students. When I started teaching yoga, there was no one teaching yoga anatomy. There wasn't a single book on yoga anatomy. We were using a book for dance, anatomy for dance. And there was not a great culture of critical thinking and asking questions or challenging the ideas that were being shared by teachers. And I'll say a little bit about my own journey and why this subject is so important to me, is that as a teacher, I believed in and shared a lot of these biomedical miracle claims. And I look back and cringe. while some were pretty harmless, some did harm people, and particularly vulnerable people who felt shamed, like they were being told that they were doing yoga wrong because they weren't healing from their health conditions through yoga. And I have to live with the harm that I've done in sharing that misinformation, and just hope I can keep learning and do less harm in the future. And honestly, that's not easy for me because this is embarrassing to admit, but there's still a part of me that wants to believe that people have so much respect for yoga that they wouldn't make things up for clicks or for dollars. But like, grow up, Heather. You know, part of my growing up in yoga has been learning to switch on my critical thinking. For some reason, I always kind of left that outside the room with my shoes when I was studying yoga. I took everything on board. I absorbed it. You know, it was like a sponge. And it was so passionate about my studies. Um, and I just took on board everything that was being told to me and everything I read in books. And there was certainly a lot of gold in that teaching course, but also a lot of junk. And so learning to mine for the gold and throw out the junk is still a skill that I am developing. And now when I'm learning something new, I try to apply a few strategies that I'll speak about in a moment. And I rely on teachers who have the training and skills to understand yoga research and explain it to non-academics like me, right? Probably one of the most essential skills, I think, is learning to say, I don't know. I don't know what poses are good for your chakras. Maybe no one does. Or maybe there's a million ways that we can impact our energy body. The fact that there are so many different and often contradictory teachings out there suggests that we don't have to get too specific or specific at all, or maybe it's all made up. So like, how am I going to teach about the chakras when I'm like, there's this whole world of contradictory ideas out there? And so to use that example, when I teach about the energetic body, firstly, it's in environments where it's appropriate and people are signing up specifically to learn about that material. And that's really important. When I teach, I try to keep things open and invitational. And I talk about how there are various systems and ideas out there. And I try to teach more with suggestions and never pronouncements, so things to get curious about, but nothing overly dogmatic. And certainly we can speak to our students about our own experiences, right? For me, having the map of the chakras has really helped me to get to know myself better and to understand others a bit better and to have a creative practice that gives me a framework to explore the non-physical aspects of yoga, the things that we can't see or explain or intellectualize so easily. So that's what that's done for me. And I can share that with my students and hope that gives them some ideas about how they might play with this material. And also, I let people know that if this learning isn't for them now or at all, that doesn't mean they're not yogic enough, that they don't have to take those ideas on board. They can still, be dedicated yoga practitioners and dedicated yoga teachers without following that belief system. And that's okay too. Can't I just have my beliefs about yoga, even if they aren't scientific? Yeah, of course you can. You can believe anything you like. And if you're like me, you'll stay curious and you'll explore lots of different ideas through your yoga journey. But we can't do is impose our beliefs on others or demand that they make it part of their own practice or their own belief system, right? One of the most important things I want to impart today is just to be aware, both for yourself and when you're communicating with your students, what are those beliefs saying to people about their health and about their very beingness? So take, for example, the chakras. If you're talking to your students about the chakras and what they mean and how energy imbalances might show up, what might they be hearing? So if you talk about Svadhisthana chakra or the sacral center being about sexuality and birth and creation, do you have a student in your class who's hearing that they can't conceive because their energy is wrong? If you talk about heart opening poses and healing your heart, do you have a student hearing that they had a heart attack because they aren't loving enough or they didn't open up to love enough? If you talk about illness being a reflection of our spiritual journey, do you have a student fighting cancer who's hearing that they're sick because they're unevolved? So when we talk about these esoteric ideas, I think we have to be sure that students understand that these are interesting concepts for reflection and personal growth and self-knowledge, but they aren't necessarily reflected or reflective of our physical health or illness, our ability or disability. They're certainly not a measure of our morality or our virtue, right? Or our spirituality. So-called pure or evolved people get sick, they get cancer. Every yoga master that's ever lived has also died. So I think we have to be really cautious, even with our good intentions, that we're not communicating these esoteric ideas in a way that's causing shame or that's victim blaming people for being unwell, or that's causing people to fall into a place of fear over having unbalanced energy. And I think that much of this kind of belief, I know, comes from good intentions, but it certainly in my case came from a place of privilege. When we've enjoyed good health, it's easy to feel like it's because what we individually are doing in our lives and not a complex interaction of genetics and lifestyle choices, as well as the many powerful impacts of the societal determinants of health, right? And this is kind of like that just world fallacy thinking. I'm in good health or I'm having good outcomes because I'm a good person. And if someone's unwell or disabled or experiencing chronic illness, it's because they're making the wrong choices. They're not doing the right things. Their chakras are unaligned, right? And I want to talk about those things more, but let's do it in another talk because it's a really big subject. This is such a big subject, but I want to talk about some of the challenges in understanding kind of yoga science that we see out in the media and the benefits of yoga and how we, as non-scientists, most of us, might go about, my cat's biting me, is that how we might go about communicating with our students about the health benefits and contraindications in yoga, right? So the first thing I want to talk about on that subject is like unrealistic health claims. So this is something we see not just in yoga, it's kind of everywhere these days. Unrealistic health claims, biomedical miracles, and like wildly flawed ideas about contraindications in yoga. These are rampant in the yoga community, the fitness community, the wellness community in general. And you'll find that there are a lot of teachers and influencers and media organizations that are promoting yoga as a cure-all for disease, which is really misleading and really unscientific and can be dangerous for people. And so as teachers, I think it's important that we are aware of the dangers of over-promising health benefits, especially without any evidence and without any support or guidance from each individual student's health team. And that's not just on us. It's also about maybe tempering our students' expectations about how yoga might support their health and well-being. So if our students are coming to our class looking for cures, like how can you speak to them about what yoga can do? And the example that's coming to mind is not about health, and it's kind of weird, but for some reason, this came to mind the other day. I had a private student years ago who was talking about how she'd read in a magazine that doing yoga gives you a heart-shaped butt. And I don't really know what that is. I guess like an upside down heart, like your waist is narrow and then your butt does that. This was long before the whole butt obsession that we have now. This was like in the 90s or early 2000s. Anyway, she said this to me, and I'm thinking, like, what does she think yoga can do? Like, what would be the mechanism for changing the literal shape of your body? Like, she had like one of those bodies, like skinny straight up and down. How did she think yoga was going to do that? And she was determined that that was going to come through yoga. And I wonder if she was disappointed in yoga because it didn't restructure her actual body in the way that she wanted. And at the time, I was a really new yoga teacher, and I didn't know how to talk to her about that. I just sort of let it slide because, and is it my job to talk to her about that? To say, no, yoga can't do that? What do I know? We might say if someone, oh, I've had this knee pain and I read that yoga can heal knee pain. Like, that would be great. Hopefully through your yoga practice and through your work with, your health team, your physio, whatever, you can return from injury and, improve your strength and your balance and your mobility. And like, let's talk about how to keep you safe today in practice if you're experiencing knee pain, right? So like thinking about ways that you can combat the misinformation that students are coming to class with in a way that's respectful, but encouraging, right? Because we all know for ourselves or for, one of our students or someone we know, people have come to yoga with pain or discomfort or insomnia, and yoga's helped, right? It can be part of improving our health and well-being, right? I think we just need to be careful that we're not talking about curing and we're not talking about setting aside medical treatment in favor of yoga, right? I think that sets up a really great intentional space and invitational space for practice. That my hope is that through all of these things that we do, we're creating a culture where people are invited and people have agency and they have permission to take on board ideas or not take on board ideas, that it's not being force fed, and that the practice isn't a demand, that they can make choices in how they practice and what they practice and the options that they might choose. And all of that together, I think, creates a safer and more inclusive practice that in my opinion, reduces the risk of imposing on our students practices or ideas or beliefs that could be harmful over time to them. Yeah. Yoga is about getting to know yourself and kind of experimenting, and finding out, how do you respond to challenges and how do you respond to like not doing things and how do you respond to like breathing, consciously, and like all of that's kind of an experiment. And I really like this approach to like treat the class like a bit of an experiment and to come at it a little bit casually. Here's this idea, or like if you want a theme around, like I keep using the example of chakras, but if you want a theme around the chakras, like here's this idea in yoga, the chakras, and here's what it means, and you might focus on that, or you might just focus on the element of water, right? Like that's a cool thing to play with today. Or you might focus on, this other element of, that we might associate with the chakra. So it's giving people all kinds of doorways into the practice, and it's giving people the option to take a viewing perspective that might be different from ours, but that still has a value and that still could have benefit, right? So I really, really like that approach. Again, highlighting these words: curiosity, invitation, and casualness. Whatever's the newest magic bullet. Yeah, totally. It's like it says right in the sutras, like yoga is a practice, like we have to do it steadfastly for a very long time, like committedly, in order to reap the benefits. And like no one wants to hear that. They want to hear I went to yoga and suddenly I can tuck my legs behind my head. Tempering people's expectations of what they'll be able to do from doing yoga, and also what yoga will feel like on a day-to-day basis. I think that those are things we can talk to our students about. Yoga is sometimes you're going to have a sweet practice and sometimes you're going to have a sour practice, right? Sometimes everything flows and it feels so good, and like you ride on that yoga glow for days, and sometimes everything's clunky or boring and you get restless and it doesn't feel good, and like that's an experience too. And I think that part of the misinformation out there in yoga land is that we're always serene, we're peaceful, our bodies always feel so good. And as yoga teachers, like we know that's bullshit, right? Because you're you and you know what's going on up here and you know what's going on in your body. So like stopping the misinformation of yoga always feels good and we always have the same experience in yoga. I think those are also things to help temper people's expectations. So those are things you can talk about as well. Don't want to run out of time, so let me just touch on a couple things that I wanted to mention on my list. Yoga is a complement, not a substitute. So yes, yoga can support, we know this, our physical and mental health, but we need to see it as complementary to healthcare, not a replacement for professional healthcare. So, going back to when our students talk about their medical concerns, our job is to say, that's something to talk to your doctor about. I'm glad that you mentioned that and you're alert of, that you're experiencing this, and like that's something to talk to your doctor about, and ask your doctor if there's anything you should or shouldn't be doing in your yoga practice, right? Yoga can support us in our health journey, but it's not going to be the number one driver of our health. And that's something that our students need to be aware of. I think, being grounded in our ethical teaching practices is important. We've got our yamas and niyamas, which start with non-harming and truthfulness. So thinking about what are our ethical responsibilities as yoga teachers in avoiding, to the best of our ability, perpetuating false or exaggerated health claims, right? So like returning to our yamas and niyamas to guide us in clear communication about the limits of yoga's benefit, I think is something to have, like that's the foundation, right? We also have to think about like risk management concerns and even legal concerns, like making unverified biomedical miracle claims could lead to bad outcomes for your students and even legal consequences, right? So as teachers, we have a professional responsibility to be sharing correct information. So we do have to be really cautious and mindful about health-related statements, both in our classes and in our marketing and social media. That's really important. Can I just mention the role of anecdotal evidence, which is most of what we have in yoga right now, because there hasn't been a lot of research, and particularly not a lot of really good quality research on yoga. Yoga's really hard to study. How's a control group not doing yoga, but they think they're doing yoga? Like, I don't know how they do it. I'm not a scientist, so you'll have to ask a scientist. But like most of our health claims come from personal anecdotes rather than scientific research. So how do we how do we maintain an awareness of that ourselves? But how do we talk to our students about the difference between personal experience and valid evidence, especially if our students are coming to us, oh, my friend said she started doing yoga and it cured this, and like, that's great for your friend. That's what we call an anecdote. Like, that might not be true for everyone, right? Particularly, I think this is important when we're talking about vulnerable populations, that sharing these healing power claims can harm vulnerable populations, especially like people with chronic illness, people living with disability, people with serious illness like cancer. We wouldn't want to give them false hope or lead them away from necessary medical treatment because of what we think or say about the healing power of yoga. So, thinking about how do our discussions about the benefits of yoga, how could that discourage people from taking part as well, right? Like, if I talk about how yoga's a cure for this and a cure for that, does that discourage people with illness or people with disabilities or people with health issues from taking part? Like, well, if yoga didn't cure me, what did I do wrong? Maybe I did yoga wrong, so I'm not going to go back to that space, right? So there's a lot of complicated factors when we think about that. Running out of time. Here are a couple strategies I use, okay? Because we're distilling a lot of information every day, in all of our yoga studies. To ask yourself, what's the source? Does the source have a history of sharing evidence-based or balanced information? Or do they have a history of posting misinformation or very exciting junk science, right? Does this person have an education in what they're talking about, or just a passion for sharing captivating memes, right? Or hot button topics for clicks? So ask yourself, what's the source? Ask yourself, what's the mechanism? So if someone's saying you shouldn't do inversions during menstruation, what would be the mechanism of harm there, right? That can lead you to knowing the truth. If someone says shoulder stand balances your thyroid, what's the mechanism of healing? And could it also be balanced by like snoozing with your chin on your chest on the bus? So ask yourself, what would be the mechanism, whether it's a benefit or a contraindication? And finally, the last thing I want to say is, does this healing power apply to diverse populations or only like well and wealthy people? So often people talk about how yoga improves posture, yoga helps reduce headaches, yoga helps them sleep better. And for many people, yoga will have those benefits, but are they universal? Are they accessible, right? Does yoga really cure anything, or does it take us on a journey to improving our well-being, right? Could yoga alone heal a lifetime of a migraine condition or an autoimmune condition or a structural postural condition? Probably not. So if the benefit you're touting isn't universal, at least couch it in may help or may contribute, right? So that's so much information. Thank you so much for sharing this discussion. We had tangents, but they were all really super worthwhile tangents. And the things that we didn't talk about, especially the resources, I really want to share that with you. I'll type all that up for you. Hello to those of you listening to the recording. If you have further ideas of things you want to talk about in group coaching, I'd love to hear it. These are for you, so I want to be talking about things you're keen on. And have a wonderful weekend, and I'll see y'all soon.